Hi, I'm Aaron Hayes, and this week I'll be speaking on the professional informed consent form. Um, it is our duty as a professional counselor to uh, lay out all of our fees, services, risk, uh, benefits, and confidentiality for the client before we proceed with any kind of therapy or discussions. I am a resident of the state of Georgia, and I chose reflection therapy in Tuscaloosa, Alabama, so I could compare and contrast reflection therapy's informed consent form with the Georgia rules and regulations and the ACA Code of Ethics. And reflection therapy first gives the clients rights, such as asking questions about modality, and they have the right to be treated in a professional, ethical manner at all times. And under the therapist referral section, he only mentions he will not hospitalize anyone and will refer to a psychologist for any testing. That seems to me like that is missing something there, that he needs to give, examples of why he would refer to another therapist early on in therapy sessions if he doesn't feel competent. But where he talks about the Georgia guy or the qualified practitioner, that falls under the Georgia guidelines, and I'm assuming that falls under the Alabama state guidelines as well. And also in the state of Georgia, it is unethical to not notify the potential risk to the client, such as uncomfortable feelings, such as anger or depression. And reflection therapy clearly states that, you will have an array of uncomfortable feelings, such as anger, or want to express it, crying, and depression as well. But that can be worked through as part of the therapeutic relationship. A few discrepancies exist in the consent form when compared to my state board rules. When a client is being terminated, the therapist has the duty to help find alternative services consistent with the client needs. And that is part of the state of Georgia guidelines. And reflection therapy outside of normal termination terms, such as there's no more need of therapy or they cannot help the client anymore, he makes no mention about helping finding another service provider that may be able to help them more in a certain area. And the other discrepancy I found was there are no secret policies when conducting a couple or family therapy session. And I see that as some things a child or a minor would not want to disclose to the therapist, knowing that they can turn around and tell the parents and be in trouble. And in an article written by Sori and Hecker in 2015, they state the broader the disclosure policy is with regard to what the counselor shares with others, the less likely the child or adolescent will reveal important information in therapy. The more narrow the disclosure policy, the more the counselor risks becoming therapeutically immobile if there is important information that parents should know. And it is important that the counselor or agency find a sweet spot of sorts when making disclosure statements to allow the best outcome of a minor. And I do have a question about the payment guideline in the state of Georgia, allowing an individual or agency that is paying for the professional services to exert undue influence over the licensee's evaluation or treatment of a client. And who is considered an agency or individual, and how can they influence a licensee's evaluation or treatment of a client? But overall, the reflection therapy, their informed consent form held up to the ACA Code of Ethics. I don't see a problem with what they did, only with they need to have a little bit more information about referrals in there than just having one line. And other than the two discrepancies I found, it's pretty solid. Thank you.